My name is Gabrielle Carlson, and today I will be performing my final physical assessment exam on my patient here. Can you tell me your name and date of birth?
Ryan Carlson, 9/15/1995.
Okay, thank you. And can you tell me why you're here today?
Routine wellness exam.
Fantastic. Any past medical history?
I had a work-related accident that I had to have surgery on my finger.
Okay. I saw that seems like surgical history. Any medical history?
No,
Okay.
not that I can think of.
And your social history? Are you married? Do you live alone? Do you work?
Married, have a kid with my wife, a dog, and I work for a landscape company.
Okay. So you work a very hard labor job. Any use of recreational drugs, alcohol, or tobacco?
Drink socially, can't really say if it's monthly or not, just kind of socially. Don't use any drugs and don't use any tobacco.
Any medications that you're taking right now?
No.
Okay. Any allergies that you know of?
I have a nickel allergy.
And would you say that's just a rash?
It's just, I get a contact rash.
Okay. I was looking back, you do have your childhood vaccinations. Do you regularly receive your flu shot?
No.
And no COVID vaccine as well?
No.
Okay. Any other preventative care treatment that you take part of, like blood pressure screening?
No.
Okay. As I finish the subjective part of my assessment, I will move on to the physical assessment. Easily, we'll start with the head. I can say that the patient's head is round, in shape. All the structures look symmetrical and intact. I don't see any signs of lesions, trauma, or injury. Are you okay if I touch you?
Yeah, that's fine.
I'm going to palpate the patient's head here. The hair is evenly distributed, black in color, and soft and thick. Any tenderness when I touch your head?
No.
Okay. And no concussion in the past?
Not that I can remember.
Okay. Moving forward, I will take a look at the patient's eyes. Just to visualize, I can see that the eyes are equal and symmetrical. The sclera are both white. I'm going to pull down here. The conjunctiva are pink and moist. No drainage or injury noted to either of those. On with the eye exam, I would take a look at the patient's visual acuity using a Schnellen chart. Fortunately, that's not available during this assessment, so we will defer that for now. I'd like to check the patient's pupillary response. You can just take a look here at me. I'm going to shine a flashlight in your eyes.
Okay.
Look at me. Sorry. Great. Pupils are equal and round and reactive and brisk response to light. They go from about a 3 millimeter to about a 1 millimeter in size when they constrict. Moving forward, I'd like to do a confrontation test of their visual acuity to test their peripheral vision. So if you can just let me know when you see my hands.
Yep. Yep. Yep.
Great. Thank you for that. Do you wear contacts or glasses?
No, I don't.
Okay, that's great. I do recommend regularly seeing an eye physician at an annual basis if you can, just to make sure that you're not having deterioration in your eyes. Next, I'd like to move forward onto the patient's ears. I will just take a look at them both bilaterally. The left ear does not appear red or swollen, and neither does the right ear. Neither look like they have had any injury or drainage or anything like that. Any difficulty hearing at all?
No.
Okay. What I'm going to do is I'm going to cover one side, and I'm going to say a phrase, and I'm going to have you repeat it. What did I say?
Apple.
Baseball.
Baseball.
Great. Thank you. Sorry. Moving forward, I will then, if I had a tuning fork, I would like to check the patient's ability to notice any vibration and hearing. So if I would do a Wagner test, I would strike the tuning fork and place it in the middle of the patient's forehead. Other than that, and then if I had an otoscope available, I would take a look into the patient's ear and check the inner structures to check for any swelling, redness, signs of infection that may relate to any kind of complication. I'll have the patient open his mouth. Great, can you smile for me? Teeth are white, no damage or missing teeth are noted. The gums look pink and moist. Do you regularly see a dentist?
No, probably been 5 years since I've seen one.
Okay. I do recommend following up with one every 6 months. As soon as you're available, that'd be great. Open your mouth again for me. I'm just taking a look. I got my flashlight again. In your mouth. Say ah.
Ah.
Okay. Tonsils are non-swollen, non-red. I don't see any kind of abnormal findings. The uvula is of normal shape and has good movement. Any sore throats, trouble swallowing, anything like that?
No.
Give me a swallow. Can you swallow? Thank you. Puff out your cheeks. Smile. Give me a frown. Okay. And then I'll take a look at the patient's nose. Again with my flashlight, I will look up in your ears. Okay. The nose is visibly patent. No increased swelling inside of the nose, no drainage noted. And then I'll have the patient, can you turn to the left and the right with your neck? Great, and up and down. Any difficulty with that?
No.
And I forgot to say when the patient did swallow, there was no tracheal deviation. And you don't have any trouble swallowing as well either. Okay, I'm going to palpate around. At the same time, I'll probably palpate around the ears as well. And then the lymph nodes of the neck. And the thyroid. No history of thyroid disorders in your family?
No.
Okay. Move on to my pulmonary assessment. I will take a listen to all the lung fields. As the patient breathes, no shortness of breath.
No.
Okay, no chest pain.
No.
Okay. No coughing.
No.
Great, sounds good. As I just look at the patient, I can tell that his breaths are regular. They're not labored. No shortness of breath on exertion or lying down either. Correct?
No.
Okay. Give a listen. Move to the back. Some deep breaths for me. The lungs are clearly auscultated in all fields except for the lower bilateral bases. I would say they are slightly diminished. And then as I move into my cardiac assessment, without having the patient take his shirt off, I can say that no visible pulsations are noted. Thank you. And then I would take a listen to the lungs as well. we'll start with the bell. We'll start with the aortic, pulmonic, nerves, tricuspid, and mitral. Continue back through with the bell, or the diaphragm. And no history of murmurs?
No.
S1 and S2 are heard in all of the heart locations with the bell and the diaphragm. And no murmurs were noted as well. I'll have the patient lie down here. Let me move this. And I will take a listen and look and listen to their abdomen. Able to raise your shirt up for me a little bit? Thank you. Just inspecting. The abdomen does not appear to be distended or firm. I see no obvious pulsations noted. I will take a listen to you. And you're having regular bowel movements?
Yep.
Okay. I'll be listening in all 4 quadrants here. Great. And you are passing gas correctly?
Yes.
Great. Normal active bowel sounds are heard in all 4 quadrants. As I palpate. No tenderness when I touch?
Nope.
Okay. And I'll percuss. Thank you. You can actually sit up. Thank you so much. As part of my neurological exam, I would like to test the patient's deep tendon reflexes. However, equipment is not available for this assessment. So I will move forward and have the patient, I will test their cerebellar function. So with my hand here, I will have them touch my finger to their nose with each hand. Okay, and can you bring your palms up and down? And move your head side to side and up and down. Great. Cerebellar function is intact. Sorry. And as my patient walked into the room, I was able to assess that their gait was steady, they were balanced, does not use any kind of assistive device such as a cane or a walker. And then I'll move on to the assessment of the integumentary system. Visibly, to what I can see, I don't see any redness, bruising. The skin is appropriate for the patient's ethnicity. To touch in various locations of their arms and legs, and even when I touch their head, everything is warm to touch. He's not diaphoretic, and the skin is not excessively dry or anything like that. To move on to musculoskeletal, I will have the patient kind of raise their arms out and back in, out and down. For room of this exam, I will defer having the patient test their lower extremities, at least in the sense of adducting and abducting. I will assure that he has equal range of motion in all of those. I'd like to test your strength. So if you can put your hands like this and pull against, and then go like this, push against me. Okay, can you squeeze my hands? Great. And I'm gonna have you press on my hands like a gas pedal with both feet and pull up towards you. Same with your shins. And pull back. Great. He has full range of motion of his upper and lower extremities and his head and neck. Strength in upper and lower extremities are +5. As I am assessing all of this, I also want to feel the patient's pulses, so I'll feel the brachial on both sides, the radial, great. I want to feel her from. Can you bring your knees together? Thank you. Feeling the popliteal pulses. Great. And then into your pedal pulses. No personal history or family history of any like peripheral vascular disease or anything like that?
Not that I know of.
Okay. +2 pulses are felt in all locations. For the rest of this assessment, as far as the patient's reproductive system, I would like to ask, are you urinating regularly?
Yes.
Okay. And the rest of the general assessment would be deferred at this point for the patient's privacy. As far as moving forward, I do encourage that you follow up with your primary care physician at least annually, or as something occurs. If you're having any kinds of chest pain, shortness of breath, difficulty breathing, change in your ventilation status, I do encourage you to reach out to us, or in the event of an emergency, I want you to call 911 or seek medical intervention quickly. And then as far as management, we always like to follow preventative, like let's be proactive rather than reactive. So various community resources will have blood pressure screening that we could have you complete and then bring with you when you follow up. That way we can make sure that hypertension doesn't develop, which could lead to complications such as cardiac disease or anything like that. I encourage you to follow up with routine laboratory work during your wellness exams as well. Do you have any questions or concerns for me?
Not that I can think of at this time.
Okay, sounds great. Thank you for participating in my assessment.